Every night we get insight in the latest coronavirus developments from the experts, and tonight we're joined by Dr. Daniel Koritskis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Thanks. Good to see you once again. We've been talking a lot about the protests and COVID-19. We have seen people wearing masks, almost everyone, but of course it's hard to be socially distant. We remind people a lot you have to have face coverings. What are the other simple things that people need to be doing that might not be as top of mind?
Well, good evening, Emily. I mean, first of all, I think COVID-19 shouldn't be a reason for people not to go out and protest if they feel it's important to do so. While protesting, I think wearing a mask is clearly important, and trying not to have contact with the eyes and nose and mouth of other people. That may be hard when you're trying to provide aid to somebody who's been exposed to tear gas or to some of the irritants. But if you do have to have contact like that, make sure to wash your hands afterwards.
Okay, have that, maybe hand sanitizer with you, as well. So a new study today finds the anti-malaria drug hydroxychloroquine. We've talked about this before. It did not help prevent COVID-19 transmission in someone who had taken the drug preventatively and then been exposed to the virus. So tell me why this study was different, and maybe you can unpack those results a bit for us.
Yeah, this was a really important study. It was one of the first out of the gate. It was a randomized study, so half the people received hydroxychloroquine and half did not. It looked at people who had a significant exposure to coronavirus without any protective equipment or with minimal protective equipment. And it did show that there was transmission. Somewhere between 11 and 14% of the people in the study did in fact come down with symptoms of coronavirus. Now, they didn't have testing in everybody because it was done in a unique way where the patients could be, or the participants could be enrolled remotely, essentially. They didn't have to come into a study center to get enrolled, and they had the drug mailed to them, and they had questionnaires that they filled out electronically. But what the study showed was there was really no difference in the rate of acquiring coronavirus if you received hydroxychloroquine, or if you didn't, and many more people had side effects from hydroxychloroquine and had to stop the drug compared to the patients who got the placebo control. Fortunately, there weren't an excess of deaths in the hydroxychloroquine group, but really no sign of any benefit of hydroxychloroquine for preventing transmission.
Yeah, and important information for all of us to have. All right, Dr. Koritskis, thank you so much for your time. We appreciate it.
You're very welcome.